Hey there and welcome. Today we're going to be talking about a subject that a lot of new parents find themselves thinking about: circumcision. The whole point of this explainer is to give you a really clear, factual look at the topic, using our source material as a guide. That way you can get a better handle on all the moving parts of this decision. All right, let's get into it.
So that's the big question, right? To circumcise or not? It's a question that can feel pretty heavy, and honestly, if you're feeling a bit unsure about it all, that is completely normal. Our goal here is to just break down the key factors so you can feel more confident as you figure out what's right for you.
So here's how we're going to break it down. First, we'll talk about why this is such a common, but also complex choice. Then we'll dive into the biology, how the foreskin develops naturally. After that, we'll get into the different reasons for circumcision, see what the medical community has to say, and then we'll wrap it all up with the key decision points you'll want to remember.
Okay, first up, why is this choice so common, yet so complicated? Well, it turns out circumcision is done for a whole host of reasons, and a lot of them aren't actually medical. The decision can be deeply rooted in things like religious rituals, cultural norms, or just long-standing family traditions.
And look, it's worth saying that this can be a pretty controversial topic. So if you're a new parent feeling a bit overwhelmed or uncertain about it, you're definitely not alone. We're just here to lay out the facts as clearly as we can.
Next, let's switch gears and talk about the biology of it all. Before we can really have a meaningful discussion about the procedure, it's super important to understand how the foreskin develops naturally, because what might look like a problem in a newborn is very often just a normal stage of growing up.
So the key thing to get here is that this is a process that takes years, not weeks or months. For a newborn, the foreskin is naturally tight, so there's absolutely no need to try and pull it back. Usually, by about age 5, it can be fully retracted. If it's still not possible by age 10, well, that's a good time to check in with a doctor. The big takeaway is that patience is key. Now, what happens if that natural loosening process doesn't happen on its own timeline? Well, that can lead to a medical condition, and it has a name: phimosis. It's really just the medical term for foreskin that stays too tight to be pulled back after a boy is out of early childhood, and this condition is one of the main medical reasons for circumcision we're about to talk about.
All right, so this brings us right to the heart of the matter, the different reasons for circumcision. And it's really helpful to draw a clear line between the actual medical needs and the non-medical choices, which, as we said, often come down to tradition or personal beliefs. You can see the two paths pretty clearly here. On the medical side, you have very specific issues, like phimosis, infections that keep coming back, or real trouble urinating. Then, on the non-medical side, the reasons are totally different. They're about faith, culture, or the desire for a son to look like his father. They're all valid factors in a parent's mind, but they come from very different places.
Now, beyond those immediate issues, you might hear some other arguments for circumcision related to health. These usually center on potential benefits like protection against HIV and other sexually transmitted infections, or maybe a reduced risk of urinary infections. It is important to point out that our source material notes the evidence for these claims comes mainly from studies done in some African countries.
Okay, so we've looked at the personal, the cultural, and some of the medical reasons. But what do the actual medical professionals have to say about it all? Let's shift our focus to the general stance of the medical community when it comes to routine circumcision. This quote really gets to the heart of the medical perspective. The official position is, well, it's nuanced. The Royal Australian College of Physicians does not generally recommend circumcision as a routine thing for every baby boy. But, and this is a big but, they also say very clearly that a parent's choice should be respected.
So why are they so cautious? Well, a few reasons. First, if there's no medical need, it's basically considered an unnecessary operation. Second, any surgery, no matter how common, comes with risks, like bleeding. And finally, the foreskin actually has a job to do. It serves a natural protective function. And you can really see the impact of this medical advice in the numbers. Today, in Australia, fewer than 10% of boys are circumcised. I mean, that statistic gives you some powerful context. It shows that the vast majority of parents, likely guided by this kind of medical advice, are choosing not to do it as a standard procedure.
And here's another really crucial piece of advice. If parents do choose to go ahead with it, especially for non-medical reasons, the recommendation is often to wait. Doctors frequently advise that it's better to perform the procedure when a child is older and out of nappies, which really underscores that there's usually no medical urgency to do it for a newborn.
Okay, we have covered a lot of ground. So now, let's boil all of that information down into the most important takeaways, the things you'll really want to keep in mind as you think through this decision.
So, here's what it all comes down to from a medical standpoint. 1.
Routine circumcision isn't recommended. 2. It's best to avoid it for newborns. The times you should seriously consider it are for specific medical problems, like a very tight foreskin, infections that just won't go away, or real difficulty with urination. That's the core of it.
And all of this brings us to the final and most important step. Look, the whole point of this explainer isn't to give you the answer. It's to arm you with the information you need to have a really productive conversation. The goal is to use this knowledge to ask the right questions when you talk with your doctor. Thanks for tuning in.